not really prepared.
Okay, we'll put it as
Recording session better.
We record it this way. We record it in the YouTube.
Then fine. Then
you
yes.
the access now becomes like only the people who have the link.
As I said last time, I want a particular topic, and then I need some preparation to come in, because I don't want to give any false message that will go live on YouTube. Just avoid it. Nothing else. Yeah.
Okay. So we have started anyway. Yeah, started. So welcome back again, Dr. Usha. Dr. Usha. And today's topic is a little different from what we did last time. This is the area where you said this is your area.
Yeah.
So maybe a general view of this.
Okay.
Then
it can be more of an interactive session.
Yeah, we'll make it more interactive. We'll be asking questions later. Yeah.
Thank you. Thank you.
So you can just start a little, give us background of information. How does this thing start? What could be the real cause of what is called cancer? And from history, where did this thing start with man, Kari? Is this something that we can't tell when it really started, or there's a specific time maybe that it started, and maybe at what time did it become too much, as in it became like too rampant? Maybe if you have some kind of that information. If you don't have that, we'll just talk a general information about it, its stages, why we call them with those stages, what happens maybe at this stage and this.
Yeah.
Thank you.
So to start with, you asked about is there any date? I mean, the era when the cancer started. Well, Ayurveda text, which is thousands and thousands of years ago, has mentioned about cancer. But if you see in our chapter, it is a very small component that we studied, but not as a big disease. You understand? Not a vast disease. It was mentioned somewhere as a small paragraph. Whereas the first disease, which is given very much importance, is the fever in Ayurveda. But the mentioning of the cancer was there. But I suppose it was not this rampant at those times as the way we see today. And when you said the cause of the cancer, right? What is the cause of the cancer? From the research point of view, it is some of the reasons, not the sole reason, but some of the reasons are the pollution, the food habits that we are into, and then genes. Can be some of the cancers are hereditary. Then off late, one of the paper mentions that even stress can lead to cancer. Now, what happens exactly is, from what is known, is the cancer cells are always there in the body. Even I have it. Yeah, it is there. Any cells, okay, wherever the cell is, a cancer can be produced. Cancer cells can be there, not like must be there, can be there, but it just shows up as a disease after some time.
Okay.
So the difference between the normal cell and the cancer cell is this much. Normal cell will take birth, live for some time, and dies. Okay. Whereas cancer cells, what happens? They're also cells. They are the normal cells. They're born, they live, but they don't die, but they keep on multiplying. Right? There's no death for those cells. Are known as cancer cells. So when I meant to say the cancer cells are there, doesn't mean that the cancer cells are there. Do you get my point?
Yeah.
If I'm sorry if I've phrased it in that way. What I meant to say is, this is the normal cells only, which if they keep on multiplying and there's no stop, there's no death, and that is when it becomes cancerous, and you need vigorous treatment to cut down the speed of the multiplication of cells. So for example, some of these cells are born, they live and they die. But some cells are born again, they live, and if you keep on multiplying, what happens? A small tumor-like shape is happening. Tumor starts. That's a growth. So the growth keeps on when the growth, see, many growths are there, but they're called as benign. Okay, that means non-cancerous. But if they keep on growing, then it is a concern. We have to go and check it. That is known as malignancy or cancer. Now, how do you differentiate between the benign and the malignant? Is by a biopsy. That means they'll take a little tissue out of, suppose there's a growth. You think that this is a growth, right? So what they do is they'll take a small, they cut and they take the biopsy. They take a little part of the tissues and they look into the microscope. Okay. Then they can detect they can differentiate between the cancer cells and the normal cells. Okay, that is why it is called a biopsy. It's not the only test that is done to detect cancer. There are many other tests like scans can be done. For example, if it is the bone marrow biopsy is also done. But initially they may also ask, okay, for example, any cancer in the intestine. It's very difficult to locate and take out the tissue from there, right? But then scans are done. Sometimes it so happens the cancer can start in one place and can spread to different parts of the body. Okay. That time it's difficult to detect where all it has spread. That time PET scan is advised. Positron emission test. So what I meant to say is, if it is in a very localized and there's a doubt, it is biopsies done. If it is not able to locate, then this scans are done. You can't locate where all it has spread, then it will go to the PET scan. So based on the findings that an oncologist sees, he will advise the tests. Any doubt so far?
No doubt.
So what I meant, okay.
But as you're talking, things are coming up and I feel like, oh, now I see the importance of doing a preventive fast rather than a curative fast.
Yes.
Because if these things already, somehow its presence is already there with any human being.
Yes.
Any cell. So you don't want to allow it to start to grow. You don't allow it to start anything. Just make sure that it's, let me use the word dormant. It's not active in any way. It's just sleeping for the rest of your life by doing things that, the way you have talked about causes of it, by doing things opposite that will cause it. Yeah, but I don't want to interrupt you now. Please, I want to flow of your thoughts. So just continue first.
No, that's fine. That's fine. Cancer, I'm like sort of day in and out, I'm reading. So interruptions won't affect me.
Okay.
So that's about finding out or detecting the cancer. The stages are done by the pathologists. So if it's like stage 1, 2, 3, 4 is dependent on the, for example, the cancer is localized, it is stage 1. If it has just gone to the nearest site, that is stage 2. It has gone to some of the lymph nodes, little more further, it is stage 3. Suppose the cancer is spread to some of the other part of the body, it is stage 4. For example, the cancer has started in the breast, it can be stage 1, 2, and 3. Suppose from the breast, it has gone to the brain, metastasis, it is called as metastasis, then it is called as stage 4. That is how the staging is done. Okay, so based on that, the different types of cancer need different types of treatment. That is again decided by the oncologist. It is not in our purview. So what kind of treatment based on the site, based on the stage, age, all these things are considered before giving the treatment. From Indian point of view, our country is very good in aping the West. Yeah. So other than a staple food, we are like, we have been like, it's a status, uh, eating pizza and burger, which is not a staple food. It's like a status symbol for many these days. But once in a while is okay. But on the long run, what is happening is we are not accustomed to that. Our intestine is not accustomed to that kind of a food, right? So we need to eat food which is geographically suitable. So that is how our genes are made up of. Now, what is happening is, along with the stress and the pollution, the genes which is responsible for the cell's multiplication are getting confused, right? So meaning to say, lifestyle plays a very important role in the causation of cancer. One. Second thing is chronic diseases like diabetes, hypertension, not hypertension per se, but we have seen that diabetes, like the chronic diseases like diabetes, can also lead to cancer in the long run. Third thing is our immune system. Our immune system is dependent on the both body and the mind. As I already said, the boosting immune system is based on the food we eat and how relaxed we are. In the last session, I told you how the stress plays a very important role in regulating the hormones. And if the stress is not handled well, how the hormone imbalance take place, leading to illnesses. So the lifestyle, the stress together is affecting the genes, which is responsible for the cell multiplication. So there's somebody who will monitor how much the cell has to divide when it has to die. Somebody is to monitor is our genes. Now we are going and targeting them itself, are confusing with our food, lifestyle, stress, everything. And they go haywire. The work goes haywire. I'm keeping it in very funny and a simple way to understand. So they get confused and the boss goes mad, and that is how the cell production, the cells turn into cancerous. So these are all the causes. And another theory is low immune system. What we eating today, is it energetic? Is it giving us strength? What kind of food we are feeding to the body determines our immune system. So one among the reasons is also low immune system, which can lead to cancer. So your fasting, preventive, all is these things, all these preventive, preventive things like the fasting, having food which is geographically suitable, which is suitable to a body, and which is soothing to the mind. All these things are very important to build the immune system. That is one way of fighting the cancer. Yeah.
Wonderful. Wonderful.
This is not only body, it's both the body and the mind. I told you how the food is also confusing the genes and how the mind is also confusing the genes. So both are important to keep the leader of a body to function well.
Mhm. And if we talk about pollution, is it a general one? Is it a specific one, like environmental or things like what people also feed on themselves, things that they like smoking?
Yes, smoking, right? I wouldn't say any specific thing, but overall, the I think the lead, all these things, lead, most probably the lead, which is causing lung cancer.
Okay, hey, that is metal. Exposure to lead.
I mean, this is I mean, I've studied this very long time back, but one of the pollution for the lung cancer. I mean, pollution leading to lung cancer, and of course, the tobacco, use of tobacco, passive smoking. Yeah.
And you see, let us just criticize a little. You see, like now this thing called, how do you call it? Cigarette. Most countries don't have issues with cigarettes. They buy, they sell it, and it's legal. It's a legal thing that everybody can access. Yet,
Nobody's banning it.
yeah, and it is cause of cancer. I have a friend, a close person that I know, who was a chain smoker, and this person developed. Hey, it's good. It has come into my mind. He developed something in the throat.
Yeah.
And just let's just call it the way it is. He developed a growth that was cancerous. And
I'll tell you what happens there. I'll tell you
mm,
in a few sentences. Like, see, when anybody smokes or anything, the layer inside the body, right? It is very soft. Just imagine this is a skin which is inside. Just turn it around. What is happening? We are smoking. What is that heat? Is heat and many chemicals which is passing through, right?
mm,
And after some time, what happens when there's an erosion or some wounds happen? It's very, very, very minimal. What happens? It heals. But again, we smoke. Again, it heals. After some time, what happens? This is the genes which will say that, okay, there's some harm, damage done to that area. Let us go and repair it. It will repair for one time, two time, three times. After some time, it only repairs. It will not ask the cells to stop. That is the division. That is the extra division that is happening, which will turn to cancer.
mm, mm, mm.
You got it now?
Yeah,
The
got it.
people will take their health for granted because it is not causing harm. But by the time they realize that it is affecting, it can be too late.
Mm. And you know, like in the area where I am, this issue of esophagus cancer, the one that is in the throat, is too common. What could be the reason for this? You
Throat,
even find,
throat cancer.
yep.
See, there is no reason for, okay, throat cancer can also be because throat or the any oral cancer you are talking about.
Just that area, this area where we find people having esophagus issues, especially that growth, that thing that grows, then it goes very tall, very long, that one.
I don't know which cancer, but there is cancer can happen anywhere because the cells are there everywhere. So there's no particular reason except that if somebody is prone to, for example, in a family, if somebody, the father or the mother is prone for a colon cancer, then the children will be at certain percent of risk of getting that cancer. So that way we can say, but why throat cancer? We need to check the history of the person. What is that he was exposed to? For example, skin cancer patients, if you ask them, some would be like the painters, because that the chemicals they're exposed to can lead to can lead to skin cancer, or inhaling it can lead to any kind of cancer. We don't know because they're inhaling that chemical every day, right? So only when you come
Now,
to
let
know.
me ask you something a little complex. Let's say it's the father who is doing the work of painting, and then you find this thing in the child after some time, and the father has just lived his life all through. Is it possible that it can hide itself in the genes of the father and transferred to the child?
Difficult to say that. Difficult, very difficult. It can be the exposure of the kid also, or
Okay,
it can be through the
makes sense.
genes.
Makes sense.
Because when we see the cause of cancer till today, nobody can say this is the cause of cancer. Okay, but these are all the probable reasons. I said it can be genes and it can be an indirect exposure through the father.
There's a time we were talking with the Dr. Finalov. I think he was talking about for him the main cause. You see, nobody can say exactly what the cause
Exactly.
is, but I think you have brought some. We are going to that. We are going to this point that you have talked about the stress part. I think that is, for me, it's also very strong. It could be like more. It has more percentage because we are living in a society where people are stressed. The system.
Yes.
catching up a bus, running away, you getting your time to get into your job, getting your places, the jam, the living, what, how to call it? Cost of living. It becomes
Yes.
too much for people. And then
Yes.
it bugs them. And you find people having too much stress, whether they are asleep, whether they are, and they don't even maintain relationships now because they don't have peace by themselves. So we are coming there, but let's talk about this a little from the viewpoint of this Dr. Finelov, who said that one, for him, the major cause is antibiotics, and especially the misuse of it. Because anytime somebody is a little sick, antibiotic. So this
True.
is like causing pollution in the body.
Yes, because you're not allowing the body to function normally. You're not allowing that immune system to function its work. Before it works, you want to passively heal the body, wherein you're not giving the body to take its effort to fight against the organ.
Disease itself by its own self.
Yes.
Wow. And then as we are talking, everything goes back to something called fasting. Because if you fast, anybody who fasts allows the body, even if, let's say, for example, somebody has flu, this is very common here, cold. And then you say, "How do I have cold? Give me some syrup or get me some tablets." You find that people are buying these things and they think, when I had cold, I bought this, it's working. Can you please buy? If you have cold, do not be like. But for us, those who are in fasting, this is a fasting, we feel, okay, you have a very serious one, take a 3-day fast. A 3-day dry fast, you are free. Allowing the body to correct itself by its own self.
Yes.
How about if we talk about medicine, anything about medical? How about people who are overdosing or underdosing, things like that? Is there anything related to?
I don't know what is that. I'm sorry.
Somebody is taking too much than they should take. Like for somebody has been given malaria, the dosage, but instead of taking the amount that is supposed to take, he takes more than he's supposed to take, or sometimes less than. Can this also be an issue?
I have no much idea about this. But dosage can definitely have an effect on the body, but that can lead to cancer is less known.
Okay. Somebody said, do you know anything about how to use relating with the cure? This is like the use of marijuana. Here we call it bang.
Yeah.
Yeah, medicine. Is there a way? Okay, just talking related with cancer. I don't want to put too many words.
Yeah, there is something called medical cannabis now.
Yes.
Yeah.
Let's
So
talk about it a little.
What would you like to know about it?
Relating to cancer, can it help with anything? Prevention?
Yes, some of the symptoms and mainly pain, to reduce pain.
Okay.
There's something called I'm sorry. Some patch available for palliative care, patients with palliative care. Some of them will have definitely a severe pain. For them, this cannabis in the form of medicine is given. So it is legal.
For just to help with pain, eh?
Yes, only pain, mainly pain, opium.
So it's not a curative. Can't be used
It's not
to cure.
curative. It is symptom management.
Okay. Somebody's saying we're going to talk about stress in a way. We're coming back there. Detoxification by fasting is the best way to prevent cancer. And I'm going to try and read this. It's the same person, and Kapabanti Pranayama and Bastrika Pranayama. Did I read them well?
Okay, good. No, good.
Yeah, Ayurveda herbs like Kanchernar, Giloy. This one I can't read. Giloy. I don't know how you read that.
Giloy Sattva.
Okay. Well, maybe talk about that. Which kind of herb is that?
Can you please repeat the question?
They say that there's a herb in Ayurveda that
Okay.
can help with cure, prevention, not cure, prevention. And they
Okay.
say the example is Kanchnar.
Kanchanar Gugulu.
Yeah.
Okay.
Hey, you said it. Glow. Yeah.
Giloy. Giloy.
Yeah,
Right.
exactly. Mm.
Okay. And then?
Okay, that's it. Then there's also bringing the spiritual healing force by bringing a higher vibration of harmony from your soul and spirit. Yep.
So I didn't understand, like, what do they want to know?
He's
They want to know
saying
whether this is okay.
it's like it's in support of what we are talking about, and he's giving more example. Yeah, he's giving more example of what can be used to help with prevention of cancer.
Prevention, I would say lifestyle and yoga. Ayurvedic lifestyle or yogic lifestyle, definitely fasting and other things. The Kanchanara Gugulu, yes, it is used in cancer, but it has to be, the person has to be assessed, evaluated, and then only given. So any medicine for that purpose cannot be just taken blindly. Although, yes, Kanchanara Gugulu, the Giloy Sattva is very good in improvising the human system. The Kanchanara Gugulu reduces the size of the tumor, but it has its not side effects, but it has to be evaluated. The person should be evaluated and then given. It can lead to weakness. Yeah. So yes, the good the how from Indian point of view, how we look at it is to improve the immune system or the food or medicines are nothing but season wise food, fruits and vegetables are good to start with. Seasonal food, fruits.
Seasonal food.
Yes.
And this include fruits and any other
Vegetables.
Mm-hmm.
Yeah, to start with, just coinciding with what is the nature giving and in those particular seasons is a first step where the body will also, accommodate this food, and according to the changes of the weather, the body is also accommodating that kind of food and lifestyle. So this instead of Kanchanara Gugulu, that Giloy Sattva can be taken once in a while. I wouldn't say, but again, people with diabetes and all should be careful while using that medicine. It can lead to hypoglycemia. So anything written in Ayurveda, yes, it is very much beneficial, but it has to be taken with caution than self-medication. But when it comes to yoga, that's the best thing to do, because yoga helps at both body and mind level, keeping the stress at bay. And yes, the pranayamas and bhastrika, all these practices will definitely help in reducing the stress, improving the immune system. It will not prevent cancer, but maybe it will be postponing the arrival of cancer.
Yeah. And it can keep postponing until the time you have left the earth.
Yes, that should be the goal. That should be the goal.
Wow. But as you talk, I don't know if people are going to listen. I think there's something that is making perfect sense here. Is that you're supposed to live in synchrony with the environment, eat what is available, except for the polluted things. If you're in a polluted environment, you are in a disease-prone place. It's one way or another, somebody needs to get fresh air, freshness, somewhere in the nature. By the way, those people live in the city. The best thing is that sometimes they need some things like retreat. They need to get out from the city and go into the depths of the remotest places and just relax there. Don't have a hurry of going back. I also see these things very common with these people in the city, where they run away from the city.
We cannot escape in the pollution. That's why I want to say we human beings have happily polluted the earth, Mother Earth. Okay. And now we are only trying to run away and seek for solution. What I meant to say is keep improving your immune system, and yes, taking a break and breathing fresh air weekly once, going out and breathing fresh air, it definitely adds to your health.
Yeah. And then how frequently can we do that?
See, there's no frequency. We cannot measure how much benefit you see. Can you measure happiness, love, affection? Similarly, how much your
Got you.
body is taking all these things and how much it is utilizing, it's difficult to quantify. All you need to do is have a self check that how am I feeling at this moment? Do I have to go out? Let me take fresh air. Have I had a good sleep in the last 1 week or 115 days? Have a self check. Has it sleep has been good? Has my body good? Am I feeling good? If not, take a break, refresh, come back. That is the way you need to have a self check rather than quantifying things that weekly once, weekly 3 days. It's difficult.
Yeah, get you.
Yeah.
Got you.
Eating how
Yeah.
much food you want, how much water you need, what breaks you need is you. You are the master of your body and mind.
I'm really, Dr. Usha, I'm telling you the truth. I'm really feeling grateful that we had this meeting. And I think we are talking something looks as if it is some, how do you call it? Almost like obvious things. They look as if they are obvious. Yet
Yeah.
this is exactly where people miss it. This one that looks obvious is what carries what we call between you and a serious disease, a deadly disease called cancer. Because as we are talking about like stress, some people think stress is a good thing.
Yes.
Some people think, yeah, but then we have positive stress, and it cannot be like somebody is under stress.
Yeah, that is called as eustress.
Yes.
A good stress we require to an extent where you can cope up and come back to normal. But when it goes beyond your capacity, where you're not able to come back to normal, that is means you need help. You need to seek, or you need to find ways to cope up with. That's it. But to get up in the morning, finish all the work, and go to office, yes, stress is required. It is called as eustress. But when eustress goes beyond your capability of to handle, then it is known as distress.
And as you're talking, I also see something like when somebody have issues with their couple, they're married people. You should not leave this thing, an issue, for 2, 3, 4, 5 days. It's going, taking a month, 3, 4. It's stressing you. You talk about it, repeat it angrily, and you are already breeding. That's a breeding zone for disease.
True.
Got you. Wow. It's making big sense. So people need to, actually, you always hear people say, you're supposed to be happy, but you can't just be happy faking it when you have underlying issues. First of all, deal with them, get them out from your emotions and your mind.
Take help.
Then get now the joy that you should have. Be thankful. Be what? After you have already gotten this help. Wow. Somebody wants to ask a question here, and you are welcome. You are welcome to ask as you are putting on you're unmuting. There's a question that she wrote here. What cleansing flashing against parasites Ayurveda recommends, because cancer is linked to parasites? That's a question that I think has been asked.
Yeah. Infection. Yes, had not covered it. Yes, infection also, repeated infections also can lead to cancer. Absolutely right. There are some medicines which can remove the parasites or germs in the body. It is known as Vidanga. Just like how you do the deworming in the allopathics, they give the deworming. Something like that you can also resort to. And some of the naturally removing methods for removing the parasites include even simple. Do you get pomegranate in your countries? Pomegranate. Yes, pomegranate is very good. It is anti-helminthic. Even the tapeworms, can be removed. The eggs of the tapeworms can be removed through by eating the having pomegranates. So that is one way. And as I last time said in my previous talk, once in a while, once in a year, panchakarma not only helps in detoxification, definitely some of the germs which is causing leading to cancer can also be removed.
Wow.
Hi, can I speak? Hi.
Yes,
Yes,
hi.
both of you.
yes,
Thank you. That is really interesting about the pomegranate. So the pomegranate eaten with, of course, the seeds. That's the whole point, is it?
Pardon? With what?
The pomegranate, you said it's,
Seeds, yes.
Yeah, so basically you just eat the seeds, do not spit out the actual
Yes,
seed inside
yes.
of the, yeah,
You need
just
to
chew it.
chew
Yes.
it and have it. Yes, yes.
Fantastic. Yes, it's very interesting how our bodies sometimes crave certain foods, meaning like for healing as well. Like you
Yes.
can choose a pear, apple, pomegranate, whatever. So yeah, great. That's great news.
Yes.
Only because the reason why I asked the question about cleansing, I had the fortune to go to Sri Lanka a few years ago, and a guy was ill and he was saying, "Oh, I'm going to my Ayurvedic doctor." And they put me on 2 days cleanse, with parasites cleanse and everything before they even assess my ailment, because they need to clear the intestines almost before they actually assess, is there a problem from something else, or has it been caused by food potentially. That's why I was really interested to find, of course I know about wormwood and other ones that actually help, but I was wondering about Ayurveda as well, how because you're on the call, so to pick
Yeah,
up your brain.
the many other medicines, but it is more available in India, like Vidanga. There's one medicine known as Vidanga. It kills almost all types of worms and parasites. Unfortunately, I think it is more available in India. I don't know about the other countries. So the other best thing would be your simple pomegranate. If you get amla,
Pomegranate, is there like a frequency?
gooseberries,
Yes.
Indian gooseberries preferably. That won't remove the parasites exactly. The function is a little different. It will improve your immune system so that it can fight against the parasites.
Thank you.
Welcome.
Thank you. Great.
Yeah.
Okay. How about a person who is already under medication? How can this person be helped? Maybe to heal faster, or also leave alone heal faster. Also, there are, the side effects. Sometimes it becomes too much onto the body. So is there a way of helping this person who is already taking the treatment?
When you say the healing fast or symptom management, I wanted to be more specific with this question.
More of I'm not really the symptoms, but kind of this, sometimes it becomes too much on the body. What is the treatment itself?
Okay.
The treatment,
Yes.
yeah.
Yes.
Sometimes it
Yeah.
becomes too much. So what are the things that are recommended for such like a person? A person is under treatment and feels that this sometimes it is becoming too much for the body or something like that.
Yeah, I think not. I think with my own experience, it is more of diet, which becomes very important here. I don't know how it works in other countries. Providing Ayurveda or any complementary medicines during the cancer treatment is usually the doctors avoid because we don't know the drug interaction.
Mm-hmm.
Whereas diet and nutrition plays a very important role, and again, whatever is specific to that person, be it like, for example, they can have mouth sores, nausea, vomiting. Based on that, the diet differs to that person. In my regular practice, I emphasize more and more on pranayamas, relaxation techniques.
Mm-hmm.
And in Ayurveda, there's something called as Shirodhara. I'll just put it on the chat box. Okay. The Shirodhara is very relaxing. Suppose the person is undergoing chemotherapy, the tomorrow is the chemotherapy schedule. After chemotherapy, usually 5 to 7 days, they are not supposed to go anywhere because the immune system is low and the platelets are low and the chances of getting infection are more. Just 3 days or 4 days prior to the next chemotherapy cycle, they can undergo the Shirodhara, foot massage, diet, and relaxation techniques. Sufficient for now. That is all their body will be able to take it. Trust me.
Okay, foot massage, relaxation 4 days before chemo.
Yes. Yes.
Then thereafter, after chemo, 7 days, relax at home.
Yes. 7 to 10 days. Depends, because we don't know, each one's body is different, treatment is different, side effects are different. How much time the body needs to cope up is different. So ideally 3 to 4 days before the next cycle would be a good time to do little continuous yoga sessions, then foot massage, any reflexology, then Shirodhara, or a good, other than the operated site or the treatment site, massage to the rest of the parts of the body is good enough. Along with, yes, diet, nutritious diet.
Wonderful. Wonderful.
It's a very simple. Keep it very simple. There's something called, one of my patients taught me, Dr. Usha, keep it kissing, or, use the word kiss. Keep it stupidly simple.
Keep it
Stupidly simple.
Stupidly simple. Yeah, no complications again.
Yes. Just see what your body can take, assess it, and have it. Don't have to mix everything and anything that everybody has to say. You assess, yes, take the information, no wrong in it, but you see how much you can cope up, what your body needs, what you can take, have an assessment, and just follow it.
Wonderful. Okay. Are we through with the stress part? Are we through with handling stress? So that we don't have. Do you want to add something?
Yeah, I mean, I just spoke about how the in coming to cancer, I think it is not only taking care of the body. It is also about managing the stress, I told you, either by yoga or even some external relaxation like foot massage and other things. Support system, very, very important. Emotionally and socially, the support system plays a very important role. So it is not one approach, it is a holistic approach.
You need to have family that supports you. You need to have
friends,
a community, friends
yes,
that understand what you're going through.
Yes. We forget about the support groups. Many of the patients, especially in India, it is very they take it as a taboo. They don't discuss. And I mean, I'm sorry, I really don't know about other countries. I'm only talking about how I'm seeing from past a decade. Been dealing with a lot of cancer patients, so I'm just talking from Indian point of view. They're usually isolated. They don't want to talk to their own family members. The relationship breaks, and financial burden is another thing. So it's good to communicate. It's good to communicate.
Oh, thank you.
Communicate and have that support system. Begin with having a support system. There are many things that I can talk about it. There's no end to it. So these are simple things. What I would say is, physical level, yoga, pranayamas, reflexology, foot massage, and Shirodhara. Okay, at body level. Yeah. At mind level, the relaxation techniques, yoga, and any listening to music or writing the journal about your emotions, how you're feeling, etc., or picking up some hobby and keeping yourself engaged, than feeling cancer as a failure and worthless. Fourth thing is about the social support, what I said. And the fifth one is, please, whomever you meet, most of the people keep browsing the Google, talk to many people, and they feel that the same thing might happen to them. Some can be positive and some can take the negative information and feel dejected and give up. Please, to such people, always tell them that, each one is different, each cancer is different, each treatment is different, the way one copes up is different. In my own experience, I've seen a person with 4th stage of cancer with a lot of willpower and family support did better than the person with the who had less willpower, less family support. Even though it was stage 1 cancer, person died sooner than compared to the person with the stage 4. Meaning to say, this support system plays so much of an important role in coping up with the cancer. So never compare, each one's journey is different. That's the message. Take the information, but have your own protocol.
And are there people that, whether in whatever stage they have reached, you have seen heal totally, and the cancer maybe get into remission or some kind of keyword totally, they don't have it again totally?
You're asking me anything?
Yeah, maybe I ask it this way. Do you have cases or types of cancer, or people you have helped with cancer, or you have seen get cure and this?
Yeah. Yes, very much. I had my patient whom I had taught yoga, I think a decade back, and she attended my marriage as well. Okay, I think Jyoti has reminded me. My dear father went through colon cancer, and God's grace, he's doing good. This is his like post cancer. This is his 5th year. He's enjoying with his grandsons in United States. So during and I have introduced yoga to all my family members. So as soon as we went, used to go to the hospital. By the time I could get the room booked, if you see, I don't have the pic, but maybe next time, my parents used to just sit in one corner and do the pranayama and relaxation techniques. They used to start doing yoga while we are running around and do the booking of the rooms and everything. I'm just telling you how they have incorporated yoga. Then during chemo also, my dad used to do some of the relaxation techniques. And after coming home, I used to make him, because little of the nausea and vomiting used to be there. I used to divert his mind, making him watch a lot of fishes, the underwater a species, because he loves it. So that is how I used to divert his mind. My school friend had a organic farming, so I used to bring all the vegetables and fruits from there to feed him. It was like a ritual that we followed for 1 whole year, and God's grace, we have sailed through. And this is our own personal experience. And after the treatment, because my dad's chemotherapy was once in 15 days, so we had very less time to give any other therapies. Post chemotherapy, he had the peripheral neuritis because of the side effects of the chemotherapy. So I made him undergo Ayurveda, the Shirodhara and simple massage. So his peripheral neuritis came down. And I sent him once in a year for Ayurveda, the detoxification. Not detoxification for my dad, because it is more of a rejuvenation that I'm sending him for Ayurveda. So this is my own family experience.
Wow, wonderful. Denista has still another question, maybe hands up.
Yeah, hi. I'm listening attentively. What is the stance of your Ayurveda, or you as a doctor, about vibrational medicine? Meaning, because you were talking about looking at pictures or feeling good, but vibration has a powerful healing ability, listening to music or specific vibration in order to heal. If we're talking about specifically cancer, it could be anything really. So, but what is the stance of in Ayurveda in relation to that?
In relation to the vibration?
To the vibrational medicine, that means listening to music with a specific vibration to kill specific, ailments in the body.
Okay.
So because in a way, yoga and maybe mantras, but perhaps the mantras is part of the yogic.
Mantras.
Yeah, maybe the mantras would be.
Yes, yes.
Because that is a vibration. Yes, in order
yes,
to.
chanting of Omkara is one of the example. I mean, Akara, Ukara, Makara. That's the Omkara. Chanting will help. Definitely.
Okay.
I would say that yogic relaxation followed by mantra, or mantra followed by relaxation, and having medicines post that has a tremendous effect. See, these are all not quantifiable things. It's an experience, but this is the procedure. Like pranayamas, mantra chanting, a little relaxation, followed by intake of medications. Mantra is also a part of Ayurveda. We use mantras before giving any medicines. That's a old ritual. Any Ayurveda doctor in good olden days used to chant mantra before prescribing the medication. Somehow we have lost that.
Wow. Okay. So do you think that this is because they're actually charging the medicine with the energy, or is it?
Yes, energy. And at the cell lines also, there are some PhD students who is working on some of the mantras and how they're quantifying they're measuring the vibration which can kill the cancer cells.
Oh yeah, I know that exists. Yeah, I know that exists, and yes, there are cures for cancer already. It's just that it's not popularized by the mainstream.
Yes.
So we know that.
Regularly we use Omkara mantra, and Jyoti is just put it in the message. Yes, there's something called Mahamrutyunjay mantra, like mind sound resonance technique, which is widely used in our Svyasa. I mean, the college where we are all educated from. We use this mantras, chanting, and that resonance, what is created, is supposedly indirectly killing the cancer cells or improving the immune system
to fight it. Yeah.
Fight it.
Would it be possible, Frederick, after this video, because I haven't actually, I'll watch it from the start. I'm glad to say that I haven't got any issues with the topic discussed.
Yes.
But it was more about, from the Ayurvedic point of view, what are the solutions? Would it be possible, because the doctor obviously was mentioning about specific terms, that in Indian terms about this medicine or that medicine, or like a little transcript, maybe just like a summary of like the specific Indian words that we are not familiar with, specific Indian herbs, because she mentioned, you mentioned, doctor, that you were putting it in the chat. I could not understand on what, because I cannot see it in the general chat or anything, but maybe when the video finishes, this is when we're going to be able to see it. I'm not certain. Oh, okay.
So this is a request to Dr. Usha. If you feel there are some words that we
no, not at all. I'm just not able to follow
but
conversation. I'm sorry.
Yeah. So we'll be able to access those few. There were some few medicines that you talked about. Otherwise, I think I want to say the truth. We have been talking so much of fasting, doing that, but we have never talked about the Mosa itself, the way we are approaching it today. Directly, we say putting getting the bull by its horns. we have, if there's a problem, even in my nation, Kenya, if there's a disease, there's a problem with healthcare where people are crying everywhere, it's cancer. This is what it kills anyone, doctors themselves, anybody, that family, everyone. Sometimes you even see it very merciless, because even children, sometimes very, very young, at very young age. So this is something that we need to talk about. And I want.
I have one question. How about this African traditional medicine? What do you use, and how effective it is against cancer?
We have herbs, especially the Maasai. Maasai people here have herbs, but these people do.
Chat?
Yeah, Maasai. I don't have the name of these herbs. I don't have the names of the herbs, but we have a community called Maasai.
Maasai. Okay.
Yeah, Maasai. let me write Maasai. Maasai are people who are still living in their, it's like as if the civilization is not there. Most of them, some few are still have come into towns and all that. These are people who walk. They can walk very long distances. They still depend on their animals and herbs. So they do a lot of. I tell you, they walk kilometers. Finding them in the vehicles is not easy. So they live almost like the way they are in those olden days. So these are people who even getting flu. We always talk about them here. I'm like, if you find this person with the flu, it's close to impossible. It's not easy to find them with the flu because of their physical exercises, the walking and the herbs. And you find them walking with herbs selling for us. Those who think we think we are already civilized.
That's nice. That's interesting. I've not come across Maasai because my PhD topic in one of my the paper which I'm writing, I'm collating all the alternative medicines used around the world for cancer. I've got around a summary of around 250 types till now. So
here specifically, we work on more of on the, how do you call it? The prevention. But
yes. Absolutely. So
wonderful.
I mean, if I got it wrong, got it right, Miss Denise, you want me to list out the medications or the herbs which is used for cancer, if I'm right?
I mean, both, even the one that you mentioned about parasites, it's like, it's like a little, this, yeah. Because I don't have a pen at the moment to write it. And
no, I will put it on the chat so that it is
Thank you.
there.
Thank
you. There. Yeah.
Because I'm originally from Bulgaria, even though I live in UK. I've lived in UK for over 20 years. As you said, you're thinking about what the ancients did against cancer, but in those days, as we all identified, we all been doing preventative measures, and not actually when the person get ill, now let me necessarily heal you. Whereas now, lots of people just ignoring the signs along the way, and then they get into a stage of no return and acceptance that is their fate, i.e., no longer living. Whereas I still believe in miracles, and when I say miracles, I don't mean like miracles that we can heal, through fasting, through the correct way. Emotions are a big one, that we actually store emotions, that it's your body starts to create those diseases because of the emotions. It's not like you're missing a limb. So there is lots of things, and and it's great when people actually heal naturally, or even if obviously with interventions from the general medical sort of organizations, even though that is actually poison, like when because when you were saying about your family member, that fair enough, it's healed, but like going through chemotherapy, putting poison in yourself in order to it takes a lot. And I'm sure it was for everybody that goes through this disease, because my grandmother actually did pass away, but that's many years ago in Bulgaria. There is no support, basically. Again, she was delaying, and actually died in agony. Which is really sad. My daughter is listening to me and she's like, my great grandma died of agony. Yes, she did. So it is sad to know that in this day and age, we just prioritize other things than our own health.
Yes, absolutely.
And then, and I like Frederick, because I haven't been very active on these Zooms for some time, but I like the fact that you always bring God into it. When I say God, I mean the spirit, our connection with the universe. At the end of the day, if we know what our purpose on this earth is, we're going to prioritize our lives much better. And therefore, we're going to be living longer and healthier and happier, and, without these shocking moments of disease of any sort and kind.
And you see, these things have, whatever you're talking about is actually cure, is whatever you're calling prevention. If we do these things the way we are talking about them faithfully, if we devote to what we are teaching or what we are talking about, or we can't get sick. We are not getting sick.
Exactly. And it is true, because when I joined the call, we were talking about when a person gets a cold and straight away goes for medicine or antibiotics. And again, sadly, it's the general medical practitioners that are, some of them are popularizing this because it's all about money, and we're not going to go into politics of what's what. But sadly, again, health is not on the agenda of people. And another, by the way, just quickly to mention, like drinking water, and again, energy, vibration, memory of water, etc. There is so many things. And this person, I saw this thing, and they were talking, and because person cannot survive without water for more than 3 days, and I'm like chuckling myself. Well, obviously they can. We have all proven it, with fasting and with pranic living. So again, even that, people still believe certain mythology about how a human being can live, and their limitation is all in our heads. So when a person tells me about a disease, it's about limitation in the head, and like perception, understanding. And I'm so glad to say that I'm personally doing preventative measures rather than having to deal with massive health issues, hopefully. And this is how I'm teaching my young daughter. I'm sorry I took over, but thank you for what you're doing, and for these discussions, because what I'm trying to say as well is that sadly we cannot jump people from let's say point A to point Z, and then we need to kind of slowly introduce things to them, like
absolutely.
Like exactly like Ayurveda, yoga, changing, it's really challenging for people. And step by step we can, not that we, but the circumstances might actually push them in a direction of improving their life altogether. Yeah,
Very true, very true.
yeah.
Thank
To
you.
conclude with what you said, Ayurveda first talks about prevention first and then the disease.
Yeah,
that's the beauty of the Ayurvedic texts. I think Jyoti has,
yes. Like in the Chinese culture, apparently a Chinese practitioner, like usually with acupuncture and the herbs as well, they're considered good doctor when they have least ill patients. So the least their patients are ill, that means that they're good doctors because they're preventing the patients from getting sick. That's
absolutely true. Whereas the scale, the yardstick to measure the doctor's success is based on the number of patients treated on the other hand.
Yes.
So unfortunate.
Yeah, it's so the whole system is wrong, and
true.
But I really like the fact that, hold on 2 seconds. Leah, push the door. Push. Oh, my daughter is like sorry. Yeah, so it is, I'm really, that's why I was really happy that I had the opportunity to go to India, it was only Kerala, and it wasn't nothing to do with health, but just kind of observing how people live. And sadly, in our Western understanding about the Eastern culture, people are really spiritual, etc., but I can see that the sadly the Western way of living has spread its sad, like long tentacles too far, and people have started living really unhealthily, on many levels: emotional, physical, psychological. It's just
social.
It's everything, everything, which is, and you guys, the Indian culture, you have Ayurveda, you have yoga. These are all health practices, just or exercises. But it was interesting that I was listening to a guru talking about yoga, that yoga has to be done even with because it's the alignment of the body. I mean, fair enough, everybody can do the exercise themselves, but it's actually the alignment of the body. And when the alignment happens, this is when the cosmic energy starts to flow through your body, blah 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 blah. And it was interesting, and they were talking about that it's good to have it with 2 yogic practitioners to amend you, to align you, because by just looking at the person doing it, we're just trying, but we're not actually never getting to it. So again, when your body depends of where your bones are, and you're walking, you're sitting, so it's all holistic. It's all sort of like you have to look into every single bit, and which doctor in this planet Earth is really looking at the patient, all these little things that are specific to them. And again, another thing is like about, because when I joined, you were talking about the patient supposedly ill already with cancer, because this is the topic. They will have a specific individual plan, and this is really the trick there, really having to assess it properly in order to give them the right plan, because not everything works for everybody. So yeah, how is that exactly? Is it based on the Vata, Pitta, Kapha? Like, do you assess it on that basis, or how does the actual plan get put into place? Based on what?
Based on, can I just repeat that last sentence?
Yeah, based on what? Like their age, because I've done these tests online to assess what kind of body type I have, in order to understand what kind of foods I should eat or not eat, and so
no, that's a bit tricky. It's a bit tricky. It cannot be. It's difficult to assess that way.
Yeah, but what I'm saying is, as an ill patient of cancer, because you said that they're going to be put on an individual plan of healing apart from the chemotherapy.
Correct.
So how is that plan on what? I don't necessarily need the answer from the medical perspective of, okay, he needs to take these pills, but there is something maybe that works for everybody. And
for
then
example, in India, the North Indian food is different than the South Indians. So, but when you go to the hospital, it is the same chemotherapy for breast cancer, example.
Yes.
But I am not accustomed to chapati or the roti, if you can understand.
Yes, I know them.
Whereas the North Indians will not be accustomed to rice.
Yes.
Now, how do you individualize or personalize the food?
Wow.
Based on their intestine or what they are accustomed to.
Yes.
So that's how the diet differs.
Right.
One. Second thing, the pre-existing condition of that person. For example, one person, we'll take the example of 2 breast cancer patients undergoing the treatment. One woman might have had gastritis. So again, the food differs. Another woman may have a pre-existing condition like diabetes and say irritable bowel syndrome. Again, the diet differs. The chemotherapy is the same for the both, and for both of them, the symptoms are the same. The side effects are almost the same, but the diet differs for both. And one person is a software engineer and one person is a housewife. Her stress is different from this woman. The counseling also little differs. You understand? So it's about the person per se.
Yeah.
And chemotherapy is same. It's the same for everybody. But the holistic approach towards each individual is different. And the stress and the stress is also different in both of them. It can be job-oriented stress. Here, it can be about how do I take, in India, it is a joint, it's a even if it is a nuclear family, still that woman has to take care of
the elders. Yes.
Yes. Now the emotions come in. So the counseling differs. Food differs. One is North Indian, one South Indian, differs. But the chemotherapy is the same. Again, emotional support differs. Again, social support also. One is an introvert, one is an extrovert. Now, how do you help them? Because isolation is equal to depression, and that can also have an effect on the treatment.
Absolutely. Yeah.
And did you see the difference? The same.
Oh, yes. Yeah. Thank you. Yeah. I mean, it's logical, but it's good that when you put it straightly, factually.
Yeah.
No, it's really helpful, and yeah.
Thank you. I hope I answered your question.
Yes, you did, and I sincerely hope that people that obviously are being treated by you or by the system are actually getting better, and then they change, because we all have to change, in order. Yeah, in
Yeah.
order to heal, we have to change on many levels.
This is during the treatment. This is during the treatment. Post-treatment is the cancer survivors, where again the treatment differs. The panchakarma or anything depends is dependent on the nature of the body, vata, pitta, and kapha. Also, some of the food medications or Ayurveda medications or the what do you say, the healing aspect for the survivors to come back to normalcy. Again, the detoxification or the medications differs from one individual to another individual.
Yes.
So when I said that it is about the geographically different people, again the second thing would be also the gut analysis of the gut. Is it like
well done. Yes, like a microbiome analysis.
Yes, microbiome, exactly. That is like in a way that it's called as vata, pitta, and kapha.
Yeah.
The person's constitution, the kind of disease, treatment, and his coping skills later. I mean, post-treatment, his stage, everything is evaluated and treated holistically.
Yeah. Talking about the microbiome, what exactly in India do you physically do in the, like in the profession? Is it very popular to do
Not
tests?
yet.
Not yet. No. Yeah.
There's still, I would say, the lot of research is going on, but it's time to follow it practically, is what I can say. It's not coming out as like a lifestyle that has to be followed, but research is still going on, what it happens, where it happens, how it works. The problem is the research findings are not getting translated to clinical.
You mean that they just as research, but not necessarily put into practice?
Exactly. Even yoga day is done on June 21st. After that, what happens to yoga? Ideally, every month 21st should be the practice. Could have been a practice for our country, like, we being the pioneer. So what I mean to say, when there is no practice, it is only preaching.
Yeah, you're right. Yeah.
Yeah.
It's fascinating.
Yes, from Ayurveda point of view, yoga point of view, this is how the constitution differs, the way you treat the person differs. And I'm also talking, when I say from emotional support and other things, is also from yogic perspective, which is on the panchakosha level, that is physical, mental, emotional, psychological, and social, all the layers. WHO.
Thank you. Yeah, thank you so much. We want to have a meeting with the same Zoom in 3 minutes time. So
okay, Jyoti raised her hand. I think we can end with Jyoti. Jyoti had anything to say?
Are you there, Jyoti?
No. Okay, she has no question.
She's there. She's there. But she has no question now.
No.
Okay.
She raised her hand that time, so yeah.
I saw her hand and she lowered it, I think, after some time. So what I'm seeing, we can have another one, maybe when we arrange again with Dr. Usha, we can have another talk. But Jyoti, talk, please. Your hands up. Talk, please. You have to unmute your microphone. You have to come to the microphone.
Yes.
Can you hear me now?
Yes, Jyoti.
Yes, just reminding you that isn't cancer pittaja, excess of pitta in the body, one of the causes?
Vata.
Vata
is related to division, multiplication.
Okay. What's that? I didn't get. I didn't totally get. Got nothing.
See, all the doshas are always involved in cancer. All the doshas, but the multiplication is always related to vata. Gati.
Oh, okay. I thought it was pittaja. Okay.
I'm once again telling you, a cancer is a bundle of all the three doshas.
Okay.
Kaphaja refers to all the muscle-related, connective tissue-related cancers. Pitta can be related to all GI cancers. But Vata is the one which gives the division, is related to the division of the cells.
Division and the pushing.
Uncontrolled, Vega. Vata is Vega, the speed.
Oh, very
That is why,
interesting. This
see,
is
in
new.
Bihar School of Yoga, they start with Pavana Muktasana series. That's it.
Mm.
I'm sorry, we went off to.
But I got some little because I understand the dosha you taught it last time when we were meeting. Talk about the doshas.
And I'm just,
Okay.
we come from the same school of thought. So just, I gave a revision about how impactful is our ancient texts, how mindful they were in doing that text, it is way back thousands and thousands of years ago, which is still people have not understood the logic behind it.
Okay. Well understood. Dr. Usha, I have to let you go for now.
Thank you so much.
I think we are going to have another meeting, but not we'll arrange for another one. Because I think it's a discussion that and if you will allow us, I think it's good it goes public if you will allow us.
Yes,
Because I'm thinking,
I just want a specific topic so that I sort of have a good flow in my talk. That is my concern. Nothing else. I'm very skeptical about.
I got your point. So next time we'll just specifically talk about one particular thing, or even if there are two in one meeting, there's no problem.
Perfect. Will do.
Yeah.
Thank you so much.
Thank you so much. Thank you for your time.
Thank you,
so much.
Janisa. Thank you, Bagini. Thank you, Frederick.
Yeah. Thank you.
Thank you. Blessings.
Thank you so much.